Okay, it looks like most folks have connected. So hello, everybody. Welcome to the call today. My name is Peter Clark. I am from Senator Shaheen's offices here in New Hampshire. Thanks for joining us for our second call with town managers in the state of New Hampshire. I'm so glad that you could join us today for this call. Before we get started, I just wanted to go through a few housekeeping items. If you are not speaking, if you could please keep your line on mute so that we reduce background noise. I'm not hearing any right now, so that's great. And then also we have a lot of folks on the call today, as you can see. So for those who are participating, if you could please keep your comments and questions as succinct as possible. We want to make sure to get to everyone who would like to make comments today. This is our second call with town managers, and we will be having more in the future. So please, if you are interested in taking part in future calls, please do reach out to our office and let us know. Before we get started today, I will just go down a roll call of our participants to make sure everyone is here. Do we have Margaret from the New Hampshire Municipal Association?
Yes, good morning, Peter.
Hey, Margaret. And Becky from the New Hampshire Municipal Association.
Yes, good morning, Peter.
Thank you, Becky. Do we have Laura Buono from the town of Hillsborough? Okay, not yet. Steve Fournier from Newmarket.
Good morning.
Hi, Steve. Arthur Capello from the town of Farmington.
Good morning.
Hello. Do we have Carrie Miner from the town of Winchester? Okay. And Denise Valley from the town of Gorham.
Yes, good morning.
Hello, Denise. Butch Burbank from the town of Lincoln. And David Stack from Bow.
Yes, good morning, everyone.
Hello. And do we have Lori Radke from the town of Hollis?
Good morning, everyone. Thank you, Peter.
Thank you. Do we have Donna Nashwati from the town of Sunapee?
Very good, Peter. Good morning, Senator.
Do we have John Isley from the town of Raymond?
Yes, good morning.
Hello. Okay, and then I just wanted to give a quick welcome to the press that we have on the line today. We have Mia Summerson from the Keene Sentinel, Kevin Landrigan from the Union Leader, David Sackwich from WMUR, Paul Hayes from the Caledonian Record, Kathy McCormick from the AP, David Steer from the Conway Daily Sun, Ethan DeWitt from the Concord Monitor, and Rick Green from the Laconia Sun. So with that, I will turn it over to Senator Shaheen.
Well, thanks very much, Peter. And thank you all so much for joining us this morning. I know it's a busy time, and so I really appreciate your taking time to raise your concerns and questions so that we can follow up on those. With me on the call are Sarah Holmes, who's the state director for my office in New Hampshire, as well as Peter, and Madison Lightfoot, who's been working with many of our nonprofits in the state. Allie Priest, who is my scheduler, who's here with me. Chuck Henderson, who handles the North Country for us. Chris Scott, who works on a lot of veterans and infrastructure issues. In Washington, we have Erica Anholt, who works on education, and Ted Trippy, who deals with infrastructure issues. So hopefully between all of us, we can answer questions, and if we can't answer them this morning, we will try and get you an answer. As I'm sure you followed over the weekend in a marathon 24-hour session, the Senate passed the American Rescue Plan, the $1.9 trillion package to respond to the economic fallout from the coronavirus pandemic, as well as respond to additional vaccine and distribution, testing, and tracing costs. It was unfortunately along party lines, but I'm very pleased that we got the bill done because I think it's going to be very important. I know you're particularly interested in the aspects of it that would help municipalities, but just to give you a little overview, in addition to about $350 billion for state and local governments, the bill includes pandemic relief checks that are going to households with individuals making $75,000, a little over that, and up to households with an income of $150,000. there's a sliding scale that goes above that. And there will also be checks for children, as well as a child tax credit that should help families, that is refundable for the next year, that hopefully will help many families. And the estimates are that it will help bring about reduce child poverty in half. I hope that is the case. There are also extended unemployment insurance benefits that are extended through the first week in September, September 6th, and include an additional $300 a week, which is basically a continuation of the program that's in place now. There are a lot of other provisions in the bill, which we're happy to address, more particularly in terms of the help for municipalities at the local level. There's 130.2 billion that's divided about equally between municipalities and counties, and that is distributed on a per capita basis. Need is a factor in it, but it's mostly going out per capita. And the good news is that these are funds that can be used to address previous COVID-related expenses, including a loss of revenue. I was interested, Margaret, in seeing the survey that the Municipal Association has done that shows that while the average community has only lost about little less than 150,000 over the last year, the estimates are that in the next year, communities could lose over $2 million. So I appreciate that there are significant costs, and based on the national figures that I've seen, virtually every state in the country has had to lay off municipal and state workers because of this pandemic. And as we look at how do we get our kids back in school, there's significant funding in the bill to help do that, to help with the cost of childcare, which has been a big issue for families, and of course help for nutrition, for rental assistance, for help with mortgages. And so I'm hopeful that we're going to see this package help us all get through the next few months with the vaccination coming and vaccine now to cover every American. And as we ramp up these programs, hopefully this will get us through so that we will see a recovery come fall and the end of the year, and people can see their lives get much more back to normal. So again, thank you all for joining me. I'm looking forward to hearing what you have to say and to seeing how we can answer questions. Oh, the one other piece that I should raise, and Ted, I'm sure people will have questions about this. There's a $10 billion fund in the state and local to help with infrastructure projects. So that's, I know, will be a very welcome fund for so many communities. So again, thank you all, and I look forward to hearing your comments and questions.
Thank you, Senator. We will jump right into it now, and we will start with Margaret Burns from the New Hampshire Municipal Association.
Well, thank you, and good morning, everyone. Thank you for including us. And I just want to say thank you, Senator Shaheen, and your office for working with us, for keeping us in the loop so that we're able to communicate with our members as well as on what's going on. There have been a lot of developments in over a period of time, so there's been a lot to communicate to our members. I'm really interested in hearing what our members have to say this morning and the questions that the town managers have. Certainly, NHMA is particularly focused on the funding that is coming directly to cities and towns, what the breakdown is between direct funding to states, direct funding to cities and towns, especially because here in New England and especially in New Hampshire, if the formula is based on the CDBG formula, we only have a handful of municipalities that are entitlement communities. And so it's a little bit different for us, and just curious in hearing how that breakdown is going to work and how that direct funding is going to get to our cities and towns. But Senator Shaheen, as you mentioned, we're also very interested in other forms of funding like the infrastructure. So although we've been very closely following the direct funding coming to cities and towns, there's a lot else in here that's of interest, whether it's going to directly help help cities and towns through things like infrastructure projects, or whether it's going to directly help the residents of cities and towns, right, to keep them on their feet, and to keep people from getting evicted, and to keep, help people who are unemployed. So really, there's a broad spectrum of interest within this bill. And it's not just the direct funding to cities and towns, although that is an incredible hurdle that we are now over and getting towards the finish line very, very quickly. So that's where we're coming from, and very interested to hear what the managers have to say this morning. Thank you.
Thanks very much, Margaret. Let me just respond to one issue that you raised. And unlike the CARES Act that we passed almost a year ago, exactly this month, this bill does not limit distribution to local communities based on size. So the funding, the 65 billion, a little over 65 billion that goes to municipalities, in addition to the 65 billion that goes to counties, that is going to go out mostly based on individual population. So communities, the bigger communities will get more of that money because they're bigger, but it really is going to go based on population. So I think that's good news for us, because we won't be limited by the CDBG formula in terms of how the money gets distributed. So hopefully that's going to be good news for communities. And we are working on a breakdown. It's not, it's still an estimate at this point, but when we have that, we will get that to you, Margaret, and so you can circulate it to communities.
Thank you. I appreciate it. And I know that there have been a number of spreadsheets that have circulated over the past month or so. So communities may have seen this one and that one. And I think it's just important to keep in mind that everything we've seen so far is an estimate, and that it continues to evolve. And we should all wait to see what those final numbers look like. So thank you.
Thank you, Margaret. And now I want to turn to Becky from the Municipal Association, if you have anything to add from the Municipal Association perspective.
Thank you, Peter. No, I really do not have anything to add, other than to reiterate the thanks to Senator Shaheen and your staff, Peter. We really do appreciate everything you do. And so we stand by ready to receive your updated information, and we'll work to get that out to the members.
Thank you, Becky. So now we will turn, I have first on my list is Steve Fournier from the town of Newmarket.
Thank you. Good morning, Senator.
Hi, Steve.
How are you?
Well, I'm glad we passed this package. I think it's going to
I can imagine that. My big concern is not what's going on right now and with the package, but what's going to happen in 6 months to a year. Businesses are, they're trying to reopen. They're trying to have some normalcy. But if they don't survive, we're going to have a lot of empty storefronts. And when we have a lot of empty storefronts, our property tax base drops, the values of the properties drops, which is our source of income. And, we're hearing once everybody gets vaccinated, that we'll have a little bump in the economy, but I'm afraid of the effect after that, if there was a fall, and what it's going to mean to us through all of our revenues, because, we don't have a lot of places we can get revenues in New Hampshire. So, that's my number one concern, is what's going to happen in a few months with property values and taxes. So.
Steve, I certainly appreciate that. And I think that's one of the reasons I've been so focused on trying to ensure there's help for small businesses. There is some additional funding in this package for small businesses, and there are two changes based on what we passed back in December and what is currently in the COVID relief package. One is that for those smallest businesses who may not have a long-term relationship with the financial institution and may have had some trouble, they get the first crack at the apple. Now, this started on March 1st, so they've still got about another week in which those very small businesses with under fewer than 10 employees can access the loan programs before larger businesses. So that's a good thing. The other important aspect of the small business provisions is that for small businesses who have lost more than 25% in the last year due to COVID, they can get a second round of PPP dollars as long as they hold out. And we are working, there are some deadlines that we're working to extend. The original deadline was the end of March. We're working to extend that so that people have more time. But you're right. And that's why I think there was so much support from whether it was Janet Yellen, the Secretary of the Treasury, or Jay Powell, the head of the Federal Reserve, to make this package big so that it can provide some long-term help over the economy, particularly for families who may have lost their jobs or who may be having trouble with housing or whatever, to try and provide help that will last over most of the rest of this year. So I'm hopeful that this will be it and that we will see coming on the heels of this and a bigger infrastructure package that may allow us to put people to work and to invest in ways that I know every community in New Hampshire would like to do.
Great. Hey, I just want to say also thank you. Your office has been great since day one. I know Madison gives us updates quite often, and it's just been really helpful to hear from the federal level. So I want to say thank you as well.
Thanks very much, Steve.
Thank you, Steve. Now we will move to Arthur Capello from the town of Farmington.
I'm all set right now.
Great. Thanks, Arthur. Well, if you have questions that come up, feel free to call our office to be in touch. I assume with Madison, you will have Madison's contact information, but of course you can reach our office at 647-7500, and that will get you to any of the staff that you need to talk to.
Thank you, Senator.
Okay. Thank you, Arthur. Next on my list, I have Carrie Miner from the town of Winchester, and I believe, Carrie, I saw you join us, so I hopefully you're here. Yes.
Yes, I'm here. Sorry for the late getting in late. Unfortunately, I don't have any questions right now. I'm all set. Thank you.
Good. Well, thanks, Carrie. I'm glad you were able to join us. And as long as people can get on the call anytime that we're on, we appreciate it.
Thank you very much, Senator.
Thank you, Carrie. Next, I will turn to Denise from the town of Gorham.
Hi, I just, whoops, let me get my video on. There. I just had one question about the CDBG. Do you know like what funds that are available are going to run through that process as opposed to just per capita? So that I'm just wondering what the LMI is going to apply to.
I don't know the answer to that yet. And the person on our staff who's been working the most closely on this is not able to be on the call this morning. So we will get you an answer to that, Denise, because
okay.
My understanding was that most of the dollars are going to go based on a per capita, but there is some need that is included in the formula.
Okay, great. And do you know on the infrastructure money, if those have to be shovel-ready projects, basically,
Ted,
to apply for those?
Can you answer that question?
I don't believe that they do. I can look into that to make sure that's the case.
Yeah, that was my understanding as well. They
Okay.
don't need to be, but again, we'll get you a specific, clear answer to that.
Okay, yeah.
Thank you, and thank you for everything you do for the North Country. It's very much appreciated.
Thank you.
Thanks so much, Denise. Next, we'll turn to Butch Burbank from the town of Lincoln.
Well, thank you very much, Senator, for having us on. That's great. Good to see you again. I had a couple of comments. First of all, I agree with just about everything's been said so far. Speaking for Lincoln, we haven't really felt the impact of jobs lost as much as the inability to find workforce. We've been very fortunate, and if anybody's taken a ride around up here, especially this weekend, I just had some calls this morning with a couple of restaurants and hotels, and we were swamped, turning away people, and people are just getting out here. Our building, we have 4 hotels that are approved, been through the planning board process, that are ready, ground ready to be built. Our home starts for our planning department. I think we have 20 some odd homes that have just about through the building permit process, and these are folks that are relocating here permanently. So that's what we're seeing. And I hear that my counterpart over the hill in Conway they're facing the same type of thing. So that's kind of unique. What we are seeing is the need to expand our infrastructure. So I was anxious to hear what Ted and you, Senator, have to say about infrastructure dollars. We currently are in the design process of expanding our water storage facilities for fire protection. We have the capacity to supply potable drinking water to this town to build out, but we currently are in the negative through our ISO ratings on water storage for fire protection. As you know, that's a huge issue when you want to keep the economy moving. So we're in the engineering phase right now to locate tank locations, and then obviously the almighty, trying to find the almighty dollar to build these tanks. So I'm hoping that some of this the monies for infrastructure, we could talk about funneling some of that our way to get that in so that we could keep going. You know, as it is, it's easy to design these projects. Getting the voters to fund is a whole different situation. So that's where we're at. I think workforce, and it's just getting, we use obviously the service industry here. We use a lot of, traditionally a lot of college age staffing and things like that. And I'm not sure that the current funding climate is going to promote that, because I'll speak with a personal family situation. I have a nephew who just this weekend, you know, at the house eating at my house, was quite out front. He's 20 years old and said, you know, there's no reason to really struggle to get back to work because I'm making more money on unemployment. And I don't know if that's a trend across the country, but it's a little troublesome because this kid is perfectly healthy. He's smart, college grad. I mean, there's no reason. So I just put that out there. That's probably not, I don't know if it's a topic we should discuss today, but I think it's going to face, especially areas of our state that are heavily dependent on service employees, is going to be a challenge. And if there is a bump in the road when we come out of this crazy COVID thing, I think that's going to be it. I think just trying to find just our rec department. Just, you know, you can use high school kids to a certain point, but you need a little bit older staff at times too. And that's becoming a challenge. So that's what I see. Other than that, the taxes have been coming in. And thank gosh, you know, I mean, I think that it's that's working out, but I can see, as Steve mentioned, I can see some bumps in the road coming. So thank you for your staff. I know Chuck has stayed in touch with us, and it's great. And I don't envy your job. I don't. So thank you very much for having me on.
Well, thanks, Butch, very much. I have heard from others, particularly some of the communities in the North Country, about an increase in people moving in. We were hearing that back last summer. I'm sure Denise, I see her nodding, she agrees with that. It's been interesting to see that phenomenon happening in northern New Hampshire. And I know we're glad to have residents come in, but it certainly adds to the cost of infrastructure and what we need to do. So we've got to be prepared for that. one of the things that struck me about the Municipal Association survey was that the water costs have gone up about 40% in communities over the last year. And so clearly, as we're looking at infrastructure, we've got to address water needs, as you point out, Butch. I wish I could say this is the first time I heard the concern about people staying home and not going back to work. I've heard that from a number of employers in New Hampshire who are also very worried about that. So I agree, it's something we've got to address. There's funding in this COVID relief package to help address retraining, which I think we need to do for some people. And we have a number of jobs that have been lost, but we've got to make sure that we can put people back to work. And I appreciate what you're saying and think we've really got to focus on that. One of the aspects of the bill that I worked to support was trying to get funding to help our restaurant industry, because it's nice to hear that things were booming in Lincoln over the weekend, but sadly we have a lot of restaurants in the state that have closed over the last year. So trying to get help for that industry, as well as the tourism industry, which has been hit in ways because of so many visitors staying home. Now, as you point out, that's beginning to pick up, and so that's good news. And if we can get people vaccinated, I think people will be much more comfortable traveling. But thank you. We will work on those other issues.
Thank you, Butch. I will now turn to David Stack from the town of Bow.
Thank you. Thank you, Senator, for everything you did. It was a long weekend. Glad you're up and at 'em with us today. We actually did okay, and we've been doing all right. A lot of the funding that we did get was for things that, we found that were kind of new to us or new in our business, as far as Zoom meetings and equipment, and we're a little bit behind on that. So that was very helpful. And then the biggest thing was the funds that we needed to step it right up with our PPE and with our processes, and buy the 55-gallon drums of sanitizer. But we did well. We've done okay. And again, we're largely bedroom community. So one thing we have seen, though, is same thing as others, is an influx of people moving here that now have the ability to work from home. And I know it's created a kind of a run on our real estate. So they've been doing well. People selling it been doing really well. But other than that, again, thank you for everything you've been doing for us.
Well, thanks very much. I appreciate that. One of the other pieces in this bill that's more focused on schools, but I think it's important, is additional help for the internet and for access to broadband and things like hotspots that many schools and communities need if they're going to get their kids back in school. It's I think one of the biggest challenges that we've got, and we've seen the disparities in communities and in students, where in the southern part of the state, where everybody has access to high-speed internet, it's much easier than in parts of northern New Hampshire and in the western part of the state where people don't. It's created real challenges. So there's help for the E-rate for schools, which again, I think is important, but it's one of those areas that long-term, I think we've got to address so we can ensure that opportunities are there for everybody. But thanks for joining us.
Thanks, David. And now I will call on Lori Radke from the town of Hollis.
Thank you, Peter, and thank you, Senator Shaheen, for your time this morning to join the group here. I just have, much like many of our colleagues that spoke already, Hollis is seeing a huge increase in residential building going on. As you know, Hollis is a very small agricultural community, and a lot of the land is being sold and used for housing development, and we're seeing a huge increase in the last year and a half, probably for many of the reasons I've already mentioned. So very interested in learning more about the infrastructure bill. I mean, the infrastructure funding that's moving forward. So I'll be watching that very closely and how we can hopefully tap into that for some of our needs here in the beautiful town of Hollis. I do have one question for you, Senator Shaheen. It's a global question regarding the pandemic. And I'm wondering what the legislative body up there in Washington is going to do in the future to help, if this were ever to happen again, what protocols are going into place so that we'll be much better prepared than I think we were in 2020. I'm just curious to know if that discussion has started and where it's at. Thank you.
Thank you for that question, Lori. It's a really important one. And that discussion is beginning to start. And there are a number of things I think people are thinking about. One is there used to be a unit within the National Security Council that was focused on pandemics and the potential threat from pandemics. That was dismantled in the previous administration. I think there is great interest in restoring that and trying to look at ways we can ensure that we get the intelligence we need to anticipate this kind of pandemic. Because as all the experts I've heard speak, they have said that this is not going to be the end, that once we get past the coronavirus, we should expect future and seeing that we need to be better prepared in the future. We need to look, I think, at our public health agencies and at FEMA, because when this pandemic started, we didn't have the personal protective equipment we needed. We didn't have the supply chain in the United States that we needed. And that's why the focus on the National Defense Act has been so critical to think about how we can produce the supplies that we need to respond to this kind of pandemic. And New Hampshire actually is doing some things that I think are important in responding to that supply chain. We have Lidl down in Rochester that's producing fabric for N95 masks. They have expanded and are adding production to be able to accommodate the needs, and they're looking long-term, not just at getting through this pandemic. The same is true up in Colebrook, where we have American Performance Polymers that's making non-latex rubber gloves for this pandemic. They're one of the few companies in the country that are doing that. So we've got to look at how we can support those kinds of basic supplies and make sure that they're made in the United States when we have a crisis in the future, so that we're not dependent on China or Southeast Asia or some other country to get what we need. I can tell you, because I'm on the Armed Services Committee, that we're looking at some of the rare earth minerals and doing a study, because so much of that we have been dependent on China for those rare earth minerals that are needed for so much of our electronics and other technologies that we do, to ensuring that we're not dependent on an adversary for those basic supplies. So those are some of the things that are going on right now. There's also an investment in health. And one of the things that is very exciting about the new vaccines is that we are tapping into new technologies from CRISPR, which is the new medical approach that's identified RNA, which is an important part of most of the vaccines and is very different. So looking at how we can invest at the National Institutes of Health, where a lot of that research is going on, is going to be very important. So you're right. We've got to ensure this does not happen again, and we've got to make some of those investments that are going to be critical to doing that.
Thank you so much, Lori. And so I'll now move to Donna from the town of Sunapee.
Good morning, and thank you again. Rather diverse group, and thank you for including me on it. I give you a little bit different perspective from the very small town of Sunapee. on the western part of the state. And as you've heard from many, we didn't fare that badly. The funds that we got did pay for changing our delivery methods, as many others have talked about. We did see a huge trend of people coming to stay here from other states in their residential homes that they already had, that they only used to come for the summer. I think we added 350 people to the checklist for the national election. So that was significant when you're talking about our small population. One of the things you have pinpointed, and please don't lose sight of it, is the infrastructure for the internet. As we all talk about our delivery services here over in the western part of the state, we've seen some beginnings based on the funds that were sent here for the broadband process. However, we always can use some additional. That was the first mile. And we're looking forward to some additional projects that are going there. I think we all understand delivery via the internet is going to be here to stay, and that seems to be one of the biggest issues. Another piece that hasn't been talked about has to do with the senior population. Because the mechanism has changed for the delivery being via the internet, especially in the social distancing, a lot of the service agencies weren't able to reopen and work with the seniors. And that I'm fearful that there are still some seniors out in the environment that are not being kept up to date because that portion of the population was so segmented during this process. And I'd like to make sure we don't lose sight of that. But thank you.
Thanks very much, Donna, and thanks for raising that, because one of the real impacts from this pandemic has been the isolation that so many people feel. And we're seeing it in kids who have been going to school remotely. We're seeing it in households where domestic violence has been an issue. We're seeing it with seniors who have not, as you point out, often been able to get out because the services that the meals, the congregate meals programs have by and large been closed, and everything, the senior centers have been closed, and everything has been switched, as you say, to remote, which has really created a hardship for a lot of people who don't have access to the internet, who don't have computers, who have not grown up with them and learned to use them. So it's one area that we really have to look at long term. There is funding in this bill that will help address mental health issues, which I think is a big piece of that. There's additional funding to help with a number of senior services. So we will, as we're continuing to delineate what's in this legislation, we'll make sure that we include those issues so that everybody can see what's there and people can get access to grants that may be available and to other assistance, because that is going to be important in helping people get back to normal. And I don't know, Madison, if you wanted to add anything, as you've been talking to nonprofits in particular that provide some of those services.
Just to echo what was just raised by Donna, the isolation having a severe impact on folks who are already traditionally isolated, and the senator's comments that the investments in mental health programs, food programs for our seniors, and some of these other investments in broadband will hopefully be helpful in helping those folks get connected.
And, you know, one of the few good news stories out of the pandemic has been the expansion of telehealth. And what we've seen is that's been a way to reach people who are often isolated, and people are looking at the opportunities, and mental health has been one of those areas, because we have a shortage of mental health professionals in certain areas. To be able to provide some of the service through telehealth is really important. And I think there is a real recognition, bipartisan recognition in Congress, that we've got to continue the expansion of telehealth that was done during the pandemic long term, because it provides such helpful health care for people who may be having trouble in other areas.
Thank you, Donna. Senator, while we're on the subject of telehealth, we have a related question in the chat about healthcare and opioid substance use disorder. Has money been earmarked for mental health, substance abuse, child protection services?
It has. It's not as much as I wanted, I will be honest with you. And there is additional funding for the substance SAMHSA funding in the package. There is not increased funding for the state opioid response grants, which disappointed me because I really thought we needed some additional help in that area. So there is support there. Again, it's not as much as I would like to have seen, but we will delineate as we're sending around what's in the package. We'll make sure that we include that because sadly, as we're talking about isolation, that's one of the areas that we've seen increase. We were beginning to make some progress on substance use disorders before the pandemic hit, and it's one area where we've seen a rise in people who are affected and a difficulty getting help because so many of those services were provided in person. And while they have continued online in many places and we're beginning to get back to some in person, it's had a real impact.
Thank you. And I wanted to see if John from the town of Raymond is on the line. Okay. And then I know Laura Buono from Hillsborough had emailed me that she was in a legislative hearing that had gone long, but Laura, I don't know if you were able to.
Peter, I apologize. I couldn't unmute.
Oh, sorry, John, go ahead.
I apologize.
No, it's
actually
a constant
Joe,
problem, John.
Yeah. So I apologize. I just wanted to say thank you very much again, Senator, you and your staff. I've been a big advocate of the interface with municipal leaders. I think that's one of the pieces that we miss in the state of New Hampshire, where we don't have the interface from the municipal to the executive level at the state level. I'm very appreciative for that. I just want to say that I really echo a lot of the concerns that are brought up, especially about elderly care and water infrastructure. And with that, I'm just going to get off the line. I'll stay on line but mute. I appreciate it. Thank you very much.
Thanks, John, and thanks for joining us. And again, we will make sure we get those specifics when we pass around the data that we're going to get to everybody.
Thank you, John. And just wanted to see, I know Laura had emailed me that she was in a legislative hearing that went a lot longer than she thought, but Laura, I don't know if you were able to join us. Okay.
Are there any other concerns that people might want to raise or questions that we can try and help get answers for as we're closing out the discussion this morning? And vaccination programs are going okay in all your communities?
Yeah, I was actually going to bring that up. The more vaccines we can get, the better. I know the Seacoast Health Network seems to be working very well. Very little delays, very smooth. Everybody I've talked to, we've got no complaints, which was shocking during the whole thing. We were expecting them, but it seems to be going very well. So just wanted to give kudos there too.
Good, thanks. Well, hopefully now that the Johnson & Johnson vaccine has been approved and is coming, getting distributed, and we're looking at the additional agreement that was made to double the number of doses. Hopefully we're going to be able to get that vaccine out faster. And of course, that's one of there's about $160 billion in this bill to help with vaccine distribution, with testing and contact tracing, which again, even though we get the vaccines, we're still going to have to continue to test and try and make sure we can identify hotspots if they appear, so we can get rid of those. I've been interested in listening to Dr. Fauci and the other medical experts who have pointed out that we're not going to eradicate the coronavirus completely, but what we've got to do is ensure that we get it to a manageable level, get everybody vaccinated. I mean, it's just like other illnesses that we have. Most of them we haven't eradicated completely, but we've gotten them to a manageable level, and we can treat people who are sick. So hopefully we're making good progress towards that. Any other concerns you want to raise in the couple of minutes? Okay, well, again, thank you all so much. We have lots of questions we're going to follow up on, and we will get you the information just as soon as we can. Hopefully, we're going to see this package passed by the House and signed by the President this week. So we'll be able to get more details. And as the guidance is coming out, that's always the critical piece. We want to make sure that what comes out in implementation is what was actually passed and provides information to all of you as quickly as possible as you're trying to respond to the questions that have been raised. So we will continue to work on that. And if you have a question that comes up, or if you see something in the guidance that's issued that you have a concern about, please share that with us, because again, the sooner we know what the concern is, the better we can help respond to it. Thank you, everybody. Stay safe. And I look forward to seeing you in person sometime in the next few months.
Thank you.
Thank you.
Thank you, everybody.